record. So as long as everybody's okay with recording, we're going to record our Power Patients Hyperbaric Oxygen Therapy webinar. I'll keep admitting people. And it is, my great pleasure. And to introduce Dr. Masha. And are you in Spain right now?
I'm in Spain. I'm Canadian, but I live in Spain. I've been in Spain. It's been 14 years.
Yeah.
It's absolutely crazy how time flies.
It is. And we're actually doing a lot with the Canadian Brain Exchange and the various foundations as well too. But I was introduced to Dr. Masha by, if you guys remember, Dr. Bieberdorf out of Minnesota, where we did the chronic dry eye research, and we did a case report on postural tachycardia. We were testing a new supplement, and we had our poster presented as well. But he introduced Dr. Masha and myself. And as you all know, I have my two daughters with traumatic brain injuries and the stroke. And I learned about hyperbaric oxygen chamber therapy when I was at the Department of Defense. And I learned from one of the doctors, that the neuroradiologist, that all the astronauts and the soldiers and the special forces folks get put into hyperbaric chambers immediately after finishing missions. And it was part of their protocol. And I'm like, what is that? And so I started researching it, and I'm like, oh my God, because I knew of it from scuba diving. I knew about bends. I knew it was very well studied, but I thought to myself, why isn't anybody telling me about this for my daughter? But it has so much more applicability to everything, in our healthcare. So without any further ado, I don't want to spoil anything. I'm going to introduce to you Dr. Masha, who is both a naturopath and she works with hyperbaric oxygen chamber. And they truly go hand in hand. And I'm going to let her explain all the science. So thank you and welcome.
Thank you for having me today, and thank you for joining this webinar. I know time is precious and we're bombarded with so much information. So I really appreciate you taking time and learning about hyperbaric oxygen therapy, because in many cases of traumatic brain injury, it can be life-saving and it can tremendously help the recovery. And my goal today is to teach you about the therapy in very basic terms. Don't worry, we're not going to go deep in science. I'll explain the benefits, and I'll explain the benefits for people who are suffering from traumatic brain injury. And then I'll answer your questions, because I'm sure you're going to have questions at the end of the presentation. Lynn, should we start? Should we wait a little longer? What do you think? Let's start. I cannot hear you for some reason.
I put my mute? Yeah, you go ahead and start. Yep.
Can I share the screen?
Yes, go right ahead.
Okay.
If you run into trouble screen sharing, I will do it.
Yeah, just give me a second.
Sure, no worries. People are still coming, so.
I am really sorry. I'll have to quit and connect again. There's something wrong here.
You want me to do a screen share? I can do it.
Yeah, but then it's a lot easier. Hold on a second. Let's.
Okay. And she's gone. She'll be back.
Marvels of IT.
Yeah, I know. It's coming from the IT guru right there in the top corner, everybody. And she's back.
Hopefully I'll be able to share the screen. If not, Lynn, you can do it.
Okay. Make you a co-host again.
Yeah.
And there you go. So you should be good to go.
Perfect. Okay.
Perfect.
Perfect. It worked. With technology, you never know, even though technology is way more advanced than humans are, with all their artificial intelligence and things like that. So today we'll talk about hyperbaric oxygen therapy. What is hyperbaric oxygen therapy and how it can help you? I don't know. Some of you might have heard about the therapy. Some of you might have tried it. For those who haven't, I'll start from the beginning with the basics, what it is. And then if you're more advanced, please ask me questions at the end of the presentation if you have more specific questions. My name is Dr. Masha. I'm a naturopathic doctor, and for the past 9 years, I specialize in hyperbaric oxygen therapy. I teach hyperbaric oxygen therapy. I speak at the conferences. I have a Hyperbaric Living podcast where I interview hyperbaric experts and patients and people who might contribute to the field. I have a YouTube channel, so I have tons of resources for the patients to learn from. And I want to start with a short video of a woman that I interviewed several months ago.
Masha, is there audio with this video or no audio?
There is an audio. You cannot hear it?
No. I think that's, I mean, we have the words, so that's good. You have to usually do a different audio option. I'll look for it.
Okay.
But go ahead.
So what is hyperbaric oxygen therapy? It's absolutely natural. It's a therapy that is administered inside a hyperbaric chamber where we deliver either ambient air or oxygen to the person. And because of the pressure, because of law of physics, this person is receiving a lot more oxygen than they do at the normal atmospheric pressure. This is what hyperbaric chambers look like. There are different types of chambers. There are chambers for many people. As you can see, there is there are monoplace chambers that can host just one person. There are hard shell chambers, soft shell chambers. Some chambers are only available at the clinic, and others can be installed in a person's home. There are many benefits of hyperbaric therapy, and today I'd like to talk more about the benefits for traumatic brain injury because it can help with a million different conditions, from children with autistic spectrum to somebody who's had a stroke to somebody who had carbon monoxide poisoning. And it's quite popular, and people know it generally as a treatment for bends, for decompression sickness. It's very popular and well known in the diverse world. So what is happening when a person has sustained a brain injury? Well, first of all, there is no blood supply to the area because it's an injury, right? So most likely this blood supply has been cut. So what do brain cells do? If it's not a severe brain injury, for example, diffuse axonal brain injury, severe brain injury, when neurons basically are being damaged. But in other types of injuries, such as concussion, for example, they just go to sleep. These cells just go to sleep because there's no blood supply and there's no oxygen that's going to the cell. There's a lot of inflammation. there is edema. So the brain gets inflamed and it gets filled with fluid, and then it becomes quite painful. And there's cellular debris because the body is not being able to clean it up fast enough. And of course, there's loss of function. We don't see most of these processes, we don't see because they're happening inside the brain, but we can see loss of function, loss of speech, memory, cognitive function. A person can experience anxiety, depression, sleep problems. You know this all pretty well. Now, when we look at the effects of hyperbaric therapy, when the person is breathing oxygen under pressure, we can see that it results in decreased inflammation, in increased oxygen delivery to the cells, and cells need oxygen to heal. Oxygen is a must-have for any cell to heal, and brain cell is of no exception. We see relief of edema, and we see new blood vessel formation. And why is this important? Because we know that the blood supply has been cut, so the oxygen cannot get there. So when we use hyperbaric oxygen therapy, your brain or any tissue will start to make new blood vessels. And these blood vessels will deliver oxygen to the site of injury. We see other things because we know from the research that recovery from traumatic brain injury depends on genetic factors as well. We know that people who have ApoE4, that's a specific gene that's implicated in Alzheimer's, for example. So people who have mutations in this gene will have more difficult time recovering from traumatic brain injury. But we also know that hyperbaric oxygen therapy acts on, it's more pressure than oxygen because we're using pressure as well, acts on genes, which results in certain genes being turned on and certain genes being turned off. So we can actually improve recovery of a person who doesn't have good genes to start with. We see something that's called stem cell mobilization, and I'm sure you've heard about stem cell therapy. So stem cells are cells that were not differentiated. You can make any cell out of stem cell, but we need to mobilize them. So a person who is getting hyperbaric oxygen treatment will see from 3 to 7 times greater stem cell mobilization than a person who doesn't. And when those stem cells are mobilized, the person can make new cells that will be used in brain, in neurological, in their nervous system. And autophagy. Autophagy is the death of a cell. If you think about it, is cell death a good thing? It is, because if cell has been damaged, we want to see it die, and we want to see it cleaned up so it can free space for healthy new cells. All these effects are possible and available with the use of hyperbaric oxygen therapy. Now, the question is, how do you use it to get all these wonderful effects that can speed up recovery from traumatic brain injury? This is all scientific evidence. I mean, there's a lot more. And I'd like to say that I take pride in the fact that hyperbaric oxygen therapy is science-based. What it means is that there are a lot of scientific reports, case reports, and clinical experience reported by doctors that show significant improvement in patients with TBI, concussion, stroke, any brain damage that has been sustained. We can see significant improvement after hyperbaric oxygen treatments. I've showed you the different types of chambers. The reason I want you to see that is that you will contact different doctors who might use hyperbaric chambers, and it doesn't matter whether it's multiplace chamber where a lot of people can fit in, or it's a monoplace chamber. If it's soft chamber or hard shell chamber, All of them work. What they do, they deliver oxygen to brain cells that desperately need it. What is involved? You need to get inside a hyperbaric chamber. That's actually me getting a treatment in my home hyperbaric chamber. We need to consider, and this slide, maybe you can make a screenshot, or if it will be available later, those are the questions that you would need to ask your hyperbaric practitioner. And these questions come up a lot. First of all, what pressure do we use? This is getting a little more into specifics, but I wanted to keep the slide in the presentation for future reference. You would have a question, how much time do I spend inside the chamber? And how often do I need to get those treatments? All of these questions need to be answered by a hyperbaric practitioner. What happens, and something that I also wanted to talk about today, sometimes people hear about this wonderful therapy, they go ahead, they rent or they purchase a hyperbaric chamber for home use, but they don't know really how to use it to get the benefits. So there are two components. One is the chamber, and the second component, how do you use it to get the maximum results? And that's what we're going to talk about today as well. How many hyperbaric sessions are needed? Important question, because if you're traveling to the clinic, it could be an issue. You have to pay for the sessions, of course, so there's financial component involved. And maybe if there are too many sessions that are needed for recovery, then it would be wise to rent a chamber or to purchase a chamber for home use, because if you're going to be using it every day, it's a lot more convenient if you have it in your home rather than traveling to clinic. If we look at acute mild concussion, let's say a school boy sustained a concussion, I don't know, jumping from somewhere, playing football or something like that, it can be resolved in 10 sessions of hyperbaric treatments, which is really not a lot. And we would administer those sessions, one in the morning, one in the evening. So they're looking at 1 week treatment. When we look at moderate to severe concussion or multiple concussions that were sustained, we would need more treatments. It makes sense, really, because the more severe is the injury, the more treatments we would need, right? For chronic traumatic brain injury, multiple treatments. And when I say multiple treatments, it could be 100 treatments, it could be 200 treatments. We can go up to 300 treatments. So you see where I'm going. If a person is getting a treatment every day, it would be basically, or you would normally miss some days because it's virtually impossible. You know, there are other arrangements people can have. So we're looking at months-long therapy that brings cumulative results. There's actually another question that I just thought of, and I don't have the slide, but I'm going to talk about it. When am I going to see the results? Because it's equally as important, right? So for mild concussion, a person would see results right away. The recovery would be, basically a person would recover in this week or 10 days of treatments, which is amazing considering that normally recovery would take much longer. In chronic traumatic brain injury, you might not see any changes for the first 20 treatments or the first 30 treatments. It's absolutely normal. If this area of the brain is sleeping, and we see it on the scan as a gray area, we actually see that it's sleeping. We need to build new blood vessels that can bring oxygen to the area and wake the cells up. And that takes this angiogenesis, which is a scientific term for building new blood vessels. It starts after the 20th session. Some people don't know it and they get discouraged because I'm sure you've tried so many things. Some worked, some didn't. You go to great lengths, try hyperbaric therapy, I don't feel anything, and get discouraged and upset. Well, don't get discouraged, please, because for some people, it might take much longer. And on my podcast, I've actually interviewed not only doctors, but also patients. And I love those stories when they would say, I was ready to give up. And then on treatment 56 or 72, I finally felt like I started to sleep better. When we talked to Lynn, I know with her daughter, she saw changes earlier, but for some people, as I said, it might take longer. I want to tell you a story. There's so many stories, but this story is quite remarkable. It's a school football player who received 2 concussions 2 weeks apart. And after the first concussion, he became nauseous. He was very emotional. He said he wanted to quit the team. And a week later, he had another 2 head-to-head contacts with loss of consciousness, and he was not able to attend school because of headaches. Over the next 2 weeks, he lost his ability to read, and he was diagnosed with post-concussion syndrome. He went to see a doctor. I mean, his parents took him to see a doctor. He was treated with steroids and antidepressants, and he didn't have any response. He couldn't attend school. He couldn't read. His parents were devastated. He was very emotional, a lot of anxiety, depression. So out of this hopelessness, his parents contacted a hyperbaric physician, and they started treating him with hyperbaric therapy. HBOT stands for hyperbaric oxygen therapy. And he received 40 sessions. So this might give you an idea of how many sessions might be needed. At 1.5 atmospheric pressure, which is not a very high pressure, and his sessions were 60 minutes long, and he was receiving 100% oxygen with his hyperbaric treatments. He recovered almost 100%. He could attend school. His high school mean scores were almost matching other students' scores. His visual motor speed improved 35%, and his reaction improved. And he had almost 100% resolution in his headaches. Now, he hasn't returned to football, and he absolutely refused to play any sports afterwards, but he's got his life back, and I think that's remarkable. How to make sure that hyperbaric therapy brings results. Now, I've really tried to put the most important information into this presentation that I could give you in this 40 or 60 minutes that we have. It's important to understand that hyperbaric therapy will always produce results. It's something that we have no control over. If somebody is put in a hyperbaric chamber and they receive oxygen under pressure, they will get results. But one person will get 10% improvement, and the other person 25%, and another person 80% improvement. So there are tricks of the trade that will help us make sure that you will receive maximum results. And this is the latest research. Even a couple of years ago, we haven't talked about it. Preconditioning is important. And what it means, all these other therapies that you've done prior to discovering hyperbaric therapy, whether it's cognitive therapy or working with your functional medicine practitioner on your diet, this will all help improve the results of hyperbaric therapy. And it's important to understand that each brain injury is unique. So treatment path should be unique too. And I think generally it's the problem with our medical system, that we have this protocol or cookie cutter approach, and we're trying to sort of push every single patient into this cookie cutter approach, and then we're surprised that it doesn't work for everyone. So look for a practitioner who is willing to look at you as a person with your history, which is unique, and develop a protocol, a treatment plan that, of course, includes hyperbaric therapy, because it's highly effective, but that's going to be unique to your situation. And this will ensure that you get the best results possible. From the patient side, we'd like to see commitment to long-term therapy. Don't give up after the 5th session. Don't give up after the 20th session. Have faith that is backed by science that oxygen under pressure will bring results in traumatic brain injury. Preconditioning, I talked about. Anything that you can do. And again, if you listen to my podcast, and I interviewed I talked to Lynn about it, actually. He was an amazing doctor. Unfortunately, he passed away last year from COVID. This doctor, he was one of the best in US in the treatment of traumatic brain injury. And we had many discussions. And he was also talking about the importance of this preconditioning, changing your diet, working with a behavioral therapist, QEG, something else that I'm going to talk about today. All these wonderful therapies that are available, they all work together. When we integrate, when we stack these therapies, we get results. And as I said, therapies that produce better results are QEG, especially when combined with hyperbarics. Ketosis. Ketosis is something, it's a fancy word for fasting. So using hyperbaric therapy, fasting produces amazing results for traumatic brain injury. QEG, I had to talk about it just because these two, hyperbarics and QEG, really are cousins, or maybe they're husband and wife. I don't know. They really, it's an amazing union of two therapies. Okay, let's put it this way. As you can see on the picture, it really involves just putting some electrodes and measuring electrical signals and mapping the brain, so practitioner can see which areas of the brain are malfunctioning, and then they use neurofeedback, which could be games or questions or things like that, that will help the improve functioning of these areas of the brain. When QEG is used together with hyperbarics, and if it's battery operated, we can even put it on a patient when the patient is inside the chamber. Results are miraculous. They're amazing. Something to keep in mind when you talk to a hyperbaric practitioner. Misconceptions. There are many misconceptions surrounding traumatic brain injury. Don't necessarily have to do only with hyperbarics, but mild, for example, mild traumatic brain injury can heal with rest. It cannot. If a person sustained even a mild concussion, they will greatly benefit from hyperbaric therapy and other therapies. We need to repair the damage that has been done. Those mild concussions sustained in school years can manifest themselves 20, 30, 40 years later. Which brings us to the next misconception. Old injuries do not respond to hyperbaric therapy. This is false. We see reports, studies, we see it in the news. People who had brain injury many years ago started hyperbaric therapy 20 years later, saw huge improvement. Why? Because these areas in the brain, as I explained, they go to sleep. It's almost like a sleeping beauty. You wake her up 10 years later, or you wake her up 100 years later. You know, she's going to wake up. So the same idea with the brain. Of course, younger people respond to therapies better than older people. Not only hyperbaric therapy, any therapy, but it doesn't mean that we don't see improvement in older people. And at one point in my career, I worked in the retirement home. So mean age of my patients was around 87. I saw some really old people there. And I was absolutely amazed at their recovery. We have this innate ability to heal that is present in all of us when the right therapy is applied. Doesn't matter how long ago was the injury. Doesn't matter how old are you. Hyperbaric therapy always works, and we can make it more effective, as I explained in the previous slides. You don't have to be treated in the hospital or in the clinic with hyperbaric oxygen therapy. It's available for home use. I have one at the back. I don't know if you can see it. That's what it looks like. It's like a huge sleeping bag. So it can be put in people's homes. What you need is a protocol, how to use it. And something to think about, changes do not occur without exposure to stimulating environment. And oxygen is this stimulating environment. It stimulates all this healing, it stimulates stem cells, it mobilizes them. It's setting the stage for healing to occur. These changes do not occur quickly. As I said, don't expect a fast recovery. And with natural therapies and hyperbaric therapy, hyperbaric medicine is completely natural because we're using oxygen and pressure. We don't use any medications or anything like that. And sometimes it takes months, and sometimes it will take years for complete recovery. But what's important is that you're moving in the direction of cure and that you're getting better every day. But of course, it will take time. And I'm sure you all heard about neuroplasticity, ability of brain to change, something we were blessed with. So brain cells can regenerate. We just have to put them in the right environment, and they really like oxygen. So when we submerge our brain in the oxygen environment, it will produce healing. I have another video, which I guess wouldn't have sound, but it has captions. And that's from Dr. Kelly Ryder, the one I mentioned, who unfortunately passed away. He's telling a story of his patient, and I actually interviewed his patient. It's quite a remarkable story. And I really want all traumatic brain injury patients to experience this profound healing that all these people have experienced. It took her over a year, but I spoke with her. Her podcast hasn't been released yet. But when I spoke to her, I had goosebumps and I almost cried the way she described.
I'm on a Zoom talking about hyperbaric oxygen chambers.
We have to mute someone.
You know, where they pump air into your brain. And I'm just finding out a bit more information.
Gillian, I'm going to put you on mute so the doctor can finish.
Oh, sorry, I didn't realize I was on. Sorry.
That's okay. That's okay. Don't worry about it.
Took me a minute to find.
It is complex and it is simple. It is simple in a way it works. It's a chamber that is filled with oxygen that person is breathing, and that oxygen under pressure, the same way if you put water in hose under pressure, it will really go with force. So the same with oxygen, plus we know that oxygen gets dissolved in plasma under pressure, so it gets to this places in our body where normally cannot get to, and that's how healing happens. There are nuances, of course, like to any other therapy. So you will need a practitioner who will guide you, but we know that it's effective, and we know that it's safe, and we know that it combines well with other therapies that you might be doing, and I think that's what's important. There are no contraindications to hyperbarics. There's actually one, which is called pneumothorax. It's an injury to the lung when a person has a collapsed lung. So when a person has that, they're taken to the hospital. They're not going to a hyperbaric chambers. Other contraindications are relative, somebody who might feel pressure in their ears and things like that. But this is all, we can solve those, like with pressure in the ears, with some maneuvers, you just equalize the pressure. It's almost like when you're on the airplane, the sensation you have when the plane is going down, you might feel that in the first couple of sessions, or you might not. It really depends on the person. Somebody has an acute respiratory infection and their sinuses are blocked. Again, they might feel pressure in the sinuses. So we either give them medication for that, or we'll wait for the sinus infection to go away. But really, it's very easily administered to the point that you can actually have it at home and do it yourself, and highly effective. If you want to learn more, as I said, I have a YouTube channel with a lot of videos about hyperbaric therapy and a podcast, and we upload podcast episodes on YouTube channel as well. Of course, it's about hyperbaric therapy, so you will find hyperbarics and other indications, not only traumatic brain injury, but you can search by the title. And I offer virtual consultations. So if it's something that you're interested in and something that you want to pursue, I can guide you through hyperbaric treatments. And when I started a podcast, I've realized that people had so many questions that I came up with an initiative. I offer a 15 minutes free consultations where you can ask your questions and see if it's something that you want to pursue or not. Because of course it's something new, and you're thinking how I'm going to feel inside the chamber. Would it help me? How many sessions would I need? So all these questions I can try to find you. I can try and help you find answers for it. So you can go to my website, book a consultation, or start with a podcast. And now we have time for questions.
Okay, so there were some questions going through in the chat. I answered some, but you also answered some, Masha, as you were going along. The link for the free consultation will be in the replay. So the replay will be posted on Sally. So there'll also be a link to either log in directly to Sally or to set up an account if you don't have it. I will also say this. We did a poster presentation with a surgeon who went from surgery to a hyperbaric oxygen chamber practice. And Masha and I discussed this before, very similar to a lot of kinds of therapists that are out there. Some docs will do things where it's shoot from the hip approach. And you have to be really, really careful and confident with that kind of doctor if that's who you're with. And so I wanted Masha to be here because her approach is so much more regimented and specific. This poster showed amazing results for young college athletes that were injured, from cheerleaders to hockey players to even people who were not athletes, but she had no protocol. She kept saying, "Do you have a headache?" That is not, rigorous in terms of that's the kind of therapy we'll do 10 if you have a mild concussion, or we might have to do 40. And so there are a lot of papers. Like I said, the Department of Defense orders this for their special ops teams. It is so well studied, it's crazy. And the first time to it, before I was in that position, I was at the Brain College community meeting. I forget the whole acronym, but anyway, I met one of the presidents of a chamber company, and he gave me this huge book of all these publications. And one of the subjects was Joe Namath, and the famous football quarterback, and his head was filled with spots. And I think it was probably because somebody asked about a 30-year-old injury. And I think after 62 dives, that number is sticking in my head, his spots were gone. I mean, gone. And so I've seen Joe Namath on TV. Now, granted, it could be a good day, it could be, who knows what, but I'm just saying the data was really there. And so this book just kept going on with research after research after research. So it's another, example of some kind of therapeutic that will help people with brain injuries, a variety. I mean, even food allergies, I'm going to guess it probably helps with mold toxicity or something like that, right? I need to get in one.
It really does. We're treating a lot of long COVID patients at the moment, and many of them have symptoms which are very similar to brain injury symptoms.
Mhm.
Why? Because COVID affects brain.
Mhm.
And we're getting remarkable results with some papers being published in long COVID. And not only that, there are many, it's not a miracle pill. I want people to really understand that, but it can help in many, many situations. Improve quality of life, take away this nagging symptoms of anxiety, depression, memory problems, sleep problems. The problem with, I don't want to go too deep into that, but the problem with traumatic brain injury is that many times it's being confused for mental health, and it's being treated as mental health, but it's not mental health, it's brain health. And that's why we're not seeing results, because we have to give treatment for the right indication. And Hyperbaric works amazingly for brain health. Yes, somebody wanted to ask a question.
Yeah, somebody had their hand up, and somebody said, if it's not covered by insurance, it's going to depend upon your state. I know there's a person here who also asked for the book. It wasn't a book to buy on Amazon. It was a collection of research. So you can go to PubMed. Masha, do you want to stop sharing, and then we can put everybody on the screen?
Sure.
I think some insurance companies, so iPhone has their hand up. iPhone. Can you unmute yourself, please? There you go.
I'm sorry. I think I'm logged in from my phone and it doesn't have my name on it, but this is Michelle Main out in Denver, Colorado.
Hi, Michelle.
Hi, Michelle.
I have just one kind of follow-up question on the case study you presented with the student athlete who wasn't going back to class and having trouble reading and all that. You said that he never played sports again. Was that simply a chosen action? I mean, are you seeing enough healing with this treatment that athletes are going back to doing their same sports, or was that just kind of his personal choice, or was it a limitation of his TBI?
I knew this question was going to come up. So he never played professional sports again. He never went into professional sports. He played sports, but not professionally. It was his choice. It was his choice. We didn't follow him up for, was it a post-traumatic stress disorder? I don't know what it was, but it was his choice. If he wanted to continue play sports, would he be able to? I cannot tell you, because that's going to be really extrapolating. But
Sure,
we know that he was able to return to normal life, and I think that's important.
Yeah, agreed. Thank you.
So I will say this, there's a company that I met, and I'll look for their card for everyone, and they have a franchise model, because the question of insurance, and I get it, it can be very, very difficult. the company makes it affordable to have hyperbaric therapy. They do not have somebody like Dr. Masha available. That's the downside. So it's a little bit where you're doing it on your own. But I will find that company, and they have 143 locations throughout the US. They also do light therapy as well as cryogenic therapy. So they try to create this wraparound service, but they came to us because they want to do clinical trials in this space. They want to be able to say, if you have this kind of an injury, which is going to lead me to the next question about hypoxic brain injury. The treating consultant in the UK said it could be dangerous, Masha, to treat with HBO therapy. So what's your opinion on that?
But why would it be dangerous if even the name implies hypoxic? So hypoxia is the lack of oxygen. So what's important to understand, we succeed in our treatment when we treat the root cause. What is causing the disease? Hypoxic injury is very common in birth trauma, and it's treated really well. If that baby is being put into hyperbaric chamber after birth, we can actually avoid so many complications, and it's being done in places like China a lot. I think due to insurance liability and things like that not being done very much in US, Canada, and other countries.
We have two hands up. One is Michelle and one is RL. So Michelle, go first, and then the other person can go.
You just kind of quickly mentioned part of what I was going to ask was about the coverage in Canada and the availability in Canada, because I know that here our healthcare system is so very different than in the States or other places. So
in my opinion, yes, I think Canada really needs to look into private healthcare, but that's absolutely different topic. Maybe to shorten the waiting period. I live in Spain where it works really well because private healthcare is maybe 20 times cheaper than US, but it's a different topic. What I wanted to say is that in my opinion, most economical way is to rent a chamber to see if it works, if it brings you the results, because you rent it on a monthly basis. In 30 treatments, you will see the difference. And then if it's something that you see as a life-changing tool, and for many it will be, then you can look into purchase. There's financing available for US and Canada. Other family members can use it too. You can do fundraising. I've had several patients who've done that, who desperately needed a chamber. So they did like a crowdfunding. Sometimes companies in special circumstances, they're giving discounts. There are ways. I think key is to try the therapy, see its effects, and then find the ways.
the other question I had was, you were talking about how it will always help. My brain injury, my issues that I have are from the radiation that I had. They gave me too much radiation to my brain. And I have many issues that have happened, even long-term, like new things that keep coming up 35 years later. Is there anything you know of that it doesn't help?
There's some things that it doesn't help.
Oh,
But
okay.
actually, radiation injury is an FDA approved indication, which means that insurance covers it.
Oh, awesome.
Mhm.
I didn't know that.
Wound healing is another big one. So if you have some kind of a wound with your injury, the wound healing will accelerate like no tomorrow. Robert had his hand up. Robert Beckman. Hi, Robert. How are you?
Hi, Lynn. Hello, everyone. Robert Beckman. I'm with Treat Now.
Mhm.
This is fascinating for a variety of reasons. Dr. Masha, I look forward at some point to meeting you. couple of points of clarification. Our group, treatnow.org, has about 135 clinics. You can go on the website, treatnow.org. 135 clinics who are part of the coalition treating with medical grade chambers. I don't know if the clarification has been made. Forgive me if it has, but in treating traumatic brain injury, mild, medium, and severe, the established protocol that works the fastest, the best over time, Joe Namath, et cetera, is a medical grade chamber, which you can't rent and bring into your house. The soft shelled canvas, lower pressure chambers you can rent. I don't speak against them, only that the established protocol for treating traumatic brain injury and all of the clinical trials that have been run have been done with medical grade chambers, which are out of the range of most people, but numerous professional athletes have them in their homes. And I can go on and on with all the people who use chambers, medical grade. They're heavy, they're plastic, they're brilliant. They work brilliantly. They're made all over the world. Treatment centers are charging in the vicinity of $250 an hour, 40 dives at 1.5 to 2.0 atmospheres of pressure. We've been responsible for over 21,000 success stories, success defined as back to your old normal, in over 90% of the cases. Joe Namath is one of those, but there are hundreds and hundreds of professional athletes who have been through this, hundreds of special operators subject to blast injury. Our mission is stopping service member suicides. We've done that in countless cases. I do mean countless. Dr. Masha's work, it's fantastic. Clearly, we can help some of you or your people by directing you to places where doctors are present. This is not to be toyed with, though, in the FDA's opinion, hyperbaric medicine is the safest device they have ever considered at the FDA. The Navy's used it for over 80 years. There have only been 2 cases of death using hyperbaric chambers. One was with a bag chamber, a grandmother and her son in a condemned chamber, and a woman with a horse in a horse chamber. They hadn't taken the shoes off, sparked, and a major explosion. But I don't want to overstate the dangers. It's considered to be, again, FDA safest device. Everyone in the United States and around the world has declared it's safe. The concern is effectiveness for using it for brain injury. And when I say brain injury, I mean traumatic brain injury and strikes from falls and aggression and strokes, neurologic disorders, amazing for neurologic disorders, near drownings, etc. 87 different uses where sadly there isn't enough money to run clinical trials on all of those cases, autism and so forth. But the evidence and anecdotal evidence is extraordinarily strong, though in the case, and back to our concern, suicide, hyperbaric oxygen is as close to a cure for suicidal ideation as medicine has ever come up with. 100% of the cases, suicidal ideation is gone with victims of blast injury, because it's not just giving hope, it is actually healing the wound to the brain. And that's what I want to emphasize. A traumatic brain injury is a wound to the brain, a wound. And there are wound healing protocols clearly demarcated in textbooks in medical school. And wound healing principles demand energy and oxygen. In no case, in no protocol for concussion anywhere in the world will you see brain wound or the word oxygen. They don't talk about it. Hyperbaric medicine is casually talked about in medical school, not taught. So doctors do not know. And when they go to PubMed and try and find out, does it work, who is it, etc., they read that it's either ineffective or it could kill you or it's unproven.
Robert, thank you. Thank you for you gave a presentation within a presentation. I just wanted to make a couple of comments on what you
Well,
said.
please,
You
I
mentioned-
apologize.
yeah,
I'm
you
wound up
mentioned-
and I want to offer congratulations.
Absolutely, yeah. You mentioned the pressure. So therapeutic range for brain injury protocols are 1.1 to 2 atmospheres. It doesn't matter. Medical grade chambers are awesome. They're amazing. Why? Because they give us a lot of leeway. We can start from 1.1 and we can go up to 2. It's an individualized prescription. One person will need 1.1 and his neighbor would need 1.5 and their grandmother would need 1.75. So of course, but it's great that we also have soft shell chambers that go to 1.3 and 1.5 because there's not enough chambers for the patients that we have. And if we can use those and we get results, and we know from the studies, because these chambers were used as sham group, so control group, and this control group showed results in this chamber. So we're much better off offering what we can and where we can. And of course, we have a lot of reports from people getting better with 1.3 as well. Does it mean that they wouldn't benefit from higher pressure? It depends on the hyperbaric practitioner. It's very difficult. I'm really against protocols, cookie cutter protocols for everyone. Those don't work. This is one of the problems with the medical system. We see a patient and we look at them by their disease and we give them protocol, and we're all different. We're all the same, have 2 eyes, 1 nose, and 1 mouth, 2 ears, hopefully, but we're very different.
And that's
Both
where we
should-
talked about, Masha, where the personalization of Sally helps you guide your patients into what they're,
Absolutely, yeah,
so-
yeah,
so- right?
here you
Because
go.
is the sleep doing this? Is the balance doing this? Are the headaches, which is going to take me to Don's question. So Don has a daughter, and Gillian, I wanted to say hi and like to hear how your son is doing, by the way. And next month we have a UK doctor, Gillian, and I think you really want to meet her. So she's Gillian's in the UK, folks, but Don's daughter, chronic case, and is asking if hyperbaric will help with migraines, but she does have a brain injury as well. So I mean, don't silo it, Don. You got to kind of look at the whole picture, the whole Rubik's Cube. So
I had patients with migraines. So what I did, first thing that I do, I look at the literature. Is there scientific research behind it? I haven't found much. I think 3 or 4 studies that looked at migraines and it showed that it worked. So I took the patients. One of them had hypoxia at birth, so lack of oxygen at birth. She was a 16-year-old, had severe migraines. She couldn't attend school for weeks. First, she'd get those migraines, then recovery, then a short period when she was fine. So we did, I think, 30 treatments, and she was much better. She was able to go migraine-free for 6 months, and then she had to come back for another series of treatments. And I talked about it during presentation. For some patients, it has to be continuous therapy. So it's not something that you do, it gets you better and you forget about it. Or we should do preconditioning, change other things. As I said, add QEEG and other therapies that can potentiate each other, and hopefully we don't have to look at this lifelong therapy. So for this patient at the moment, she comes in every 6 months, she gets 20 treatments, and then she's okay for 6 months. It works for her, it works for her family, because she can attend school, she can live migraine-free. Is it a long-term solution? We have to understand that even though hyperbaric therapy is 300 years old, the way we use it now, we've been using it for 30 years. We're learning every day, new protocols, new combinations of different therapies. So hopefully we'll get it to the level when we can do it a lot faster.
All right, are there any other questions that anybody has? We're approaching the 1 hour, we're past the 1 hour mark. So much for me sticking to my guns.
I'm just
But
looking if we answered,
I think we did. I've been trying to monitor them to make sure that we got everything. You are very welcome. Okay, so the email will go around, and if it's okay, Masha, do you want to share this, have me share the slides, or let people contact?
yes, absolutely. Go ahead. And I hope when you share the slides, people can actually see the videos.
Yeah,
the
that's what
sound.
that's the reason they asked for it. So I will do that as well.
Yeah,
And
absolutely.
and I'll send out the link so you can all book a session with Dr. Masha if you want. I highly recommend it. Next month, we will be actually interviewing a UK doctor and patient. She's amazing, Anna Leggett. She lost her life, got her life back, and she had me on her podcast as well. That's how we met. But she put together this book, a how-to book, if you will, in conjunction with this neuro doctor, Parada. I can't pronounce her last name without seeing it in front of me, but it's an amazing book. And they talked about power of patience in the book as well, asked me to review it. And I will tell you, I felt like I was reliving the experience of going through with my daughter with the story of Anna. And at the same time, the absolute, this will help with this, the guidebook that they put together. And it's only 100 pages. It's a very simple read. You can even do an audio file and listen to it like I did, right? But the guidebook of all the ins and outs, I mean, you will be really, really impressed with it. So that is the next month group from London. So yeah, so a lot's going on. We've got some trials that are, do I know anybody in Atlanta, Georgia for Hyperbaric? I will look for that company's name as well. They have 140 clinics around the country. I do not know what they charge, but I know they don't
I
have
think Atlanta, Georgia is Patients Help Patients.
patients, health
PHP.
patients. Okay.
Patients Help Patients. He's an amazing family behind this hyperbaric clinic is absolutely amazing. He's a friend of mine. He was on my podcast. They've been doing this for a long time. They're actually doing a lot of fundraising for their patients. They're providing a lot of therapy for free. They're really good Samaritans out there. There are a lot of good people out there who really trying to help. And if you listen, to sum it up, if you listen to the podcast, the Hyperbaric Living with Dr. Masha podcast, and the episode on traumatic brain injury, this woman, the first video, whose husband was involved in a severe accident. She's a nurse in Hawaii, and she was saying how hyperbaric therapy should be available to traumatic brain injuries right in the operating room, because it will improve chances of survival and speed up the recovery. And she's fighting for that. And I really hope that becomes the case one day.
Yeah. Well, you should, I need to connect with her because we're working with the state of Hawaii and bringing the research to their programs there. And
They
so,
opened a clinic. I mean,
Yeah.
it was absolutely life-saving for her
Yeah.
husband, who was giving 0.1% chance to live.
yeah, that's
And
amazing.
he is here, he's talking. And I remember I was posting this short videos, and then he commented, he said, I'm the guy you're seeing on these videos. And
That's
this was amazing that he was actually able to do
Yeah.
that.
That
Yeah,
is
so
amazing.
they have a clinic now in Hawaii where they're providing hyperbarics, and I'm sure she'll be happy. And if somebody's in Hawaii, I think it's called Mona Warrior Clinic or something like that. If you're interested, send me an email and I'll send you.
Okay, yeah,
the name
no,
of the
I
clinic.
want to send it to the Hawaii team we have out there. So yeah, for sure. Yes, and any clinical trials, a letter will be announced through all of our social media as well as our newsletters. One is specific for stroke. It's all remote. It's really, really cool because we're looking at being able to identify markers for stroke prevention. The other one will be for gait and balance work and things like that. That will also be remote. So, I'm trying to keep that in mind in terms of what we can do to help everybody as we move forward in the progression. So other things are coming up. So next month will be the UK doc and the survivor, and any hyperbaric in Saskatoon, Saskatchewan. I don't know. I'd have to Google it.
Yeah, that's like the end of the world in Canada. Absolutely. Yeah, I think there should be. It cannot be any other way. And probably best way to search is to go on Hyperbaric Association website for Canada, and they will have a list of providers.
And if you want, I can connect you with the brainchanges.org, the foundation that we're working with in Canada as well too. So Masha, I want to connect you with them because they brought in the whole policymakers and said, will you send this to everybody? So I'll send them your follow-up as well from this video.
Thank you, Lynn. Yes, I really appreciate everyone being here today.
Yeah. All right. Yes, remote trials. Everything will be always out and about and sent to you guys. So keep tracking. You don't have to track every day. You can just track when you need it. We've got a lot of changes, a lot of UX design this year where Sally is talking to you. We were able to calculate with MIT how to actually numerically assign a severity score. We can tell you how dangerous that bump on your head really is now. And that's a big deal. That's a game changer in terms of giving people the ahas that they need to hear so that they don't go back to either sports too soon, or perhaps it's being a service member, whatever it is, but to be much more mindful of their head injury. So with no further ado, Dr. Masha, it is always wonderful to see you, and I appreciate all the time that you took. I know it's a little bit later over in Spain than it is here. Everyone, thank you for attending. Can't do this without you, so we will be in touch. Joyce, it's great seeing you.
Thank you, everyone.
Okay, bye everybody.
Bye. Bye.